Good morning again, y'all, and welcome to our presentation that we'll be doing on HIV 101. I will be co-facilitating this presentation with Grace Ruther. A little bit about me. Again, my name is Stephen Johnson, and I work here at Philadelphia Fight. I'm the lead coordinator for the Teach Outside program. And Teach Outside is designed specifically for HIV positive people who have a former history of being incarcerated or detained. And what I want to say about this space is a unique space, right, for people who are newly diagnosed who want to learn about the virus. For that fact, if you're any age or in your diagnosis, it's a great place to come and learn about what you're living with, and a great place to be an activist and an advocate, excuse me, to learn how to be those things. I'm also the lead coordinator for the peer navigation educators. And what we do there is we help the clients navigate their patient portals. The patient portal is a great space to be in. You know, it provides a way for the client to be more rapidly advanced to their doctors, to their physician. It's great for lab works. Everything lives in one place. I wish I would have known about this a long time ago because I would have been utilizing it myself. So without further ado, I'm going to go ahead and wait a minute. Grace, did you want to tap in? You want to do a little brief introduction here, or you want to come in on the end?
Yes, good morning, everybody, and welcome to the webinar HIV 101. I'm quite excited to be here. I am the Deputy Director in Teach, Deputy Director Teach and Ancillary Services. I coordinate all the Teach activities, and that includes the alumni, which has like 3,000 members who have graduated from Project Teach. We have the main Teach, which is an 8-week course, and which begins, the next one begins July 11th for 8 weeks. We also have the Youth Teach, and we'll be having, these are for Teach members, people living with HIV who are ages 18 to 30, and we'll be having a seminar down in the mountain in September. So you're welcome to contact us. We also have Teach Outside, which Steve has already talked about. We have the Women's Teach, which is specifically designed for anybody identifying as a woman. And then we have Frontline Teach for those who do not have HIV but have families who have HIV or just want to know more about HIV. And soon we will be having Staff Teach. So you're welcome. And I hope you will enjoy and get a lot of information and also give us feedback from the webinar. Thank you.
Thank you, Grace. So we're going to go ahead and get started with our presentation on HIV 101. Our topics today: HIV basics, HIV and AIDS are not the same, HIV transmission and prevention, HIV testing, treatment for HIV, and learning more. This here we're looking at here is a Philadelphia map of all people that's living with HIV that resides in Philadelphia. What's fascinating about this map is that when you look at it, right, it got several different colors on it. White being no cases, and that teal color or that greenish color one is 10 or more cases. But when you look at this map, you begin to realize that there is almost no area in Philadelphia without somebody who is living with a diagnosis of HIV and AIDS. That's the crazy part. You know, it's like it's out there. It's all around. It's a lot of people in Philadelphia that are living and thriving with HIV. But let's talk about the prison system, because that's also highlighted on this map. And the reason being I want to talk about it because we know that the prison system is a hot spot, right? It's a lot of things that's going on in the prison system that causes people to acquire HIV. But that's only the one half of it, right? Because many of those who are HIV positive, who find out that they're HIV positive in prison, was probably already infected on the outside. And I can speak to that because, you know, when I, once upon a time in my life, I was doing drugs, I was smoking crack. So I was having unprotected sex. You know, it was always in the back of my mind, yeah, I could, but I didn't know about no symptoms. I didn't know about, you know, what to expect if you did have it. You know, I wrote it off when I was losing weight. I said, I'm only losing weight because I'm only eating potato chips and a hug. you know, in the night sweats, because I used to sweat so bad at night and wet the bed from sweat that I dismiss that as that's just the, you know, the drugs coming out of my system. And it was crazy. When I got into the penitentiary, I found out that I was HIV positive. Bang, it hit me. So many come from segments of the population that carry, you know, a heavier than average burden on infections, right? And in addition, many of those in prison are there because of, you know, drug use, because of trafficking, either selling it, you know, some form of it. And they will be continue to do their drug use inside once they get inside the penitentiary. Don't nothing change. You know, for me, when I went into the penitentiary, that was a moment for me that God saved my life. You know, that was the time that I didn't do drugs, that I didn't smoke cigarettes when I was in the penitentiary. But that's not the case for everybody. You know, I've also witnessed that some people smoking crack and chicken bones, smoking marijuana, doing all types of drugs in the penitentiary. Many men in Philadelphia prison have sex with other men, whether it be through consent or by force, but it happens. That's the reality. It happens, right? And denying or ignoring any of these facts, right, will not help solve the problem, but instead it will continue to spread HIV because of lack of knowledge, education around it. Both forms of these behaviors is a high risk for transmission, HIV transmission. So let's see, what is HIV, right? So HIV stands for human immunodeficiency virus. And it's a virus that weakens the immune system over time. But let's talk about what kind of virus it is exactly. So HIV is a virus that affects only humans. Let's state that first. HIV only affects humans. You cannot get HIV and give it to your cat, dog, or the monkey, or vice versa. It is for humans, only to humans. In addition, many of those in prison, I'm sorry, excuse me, I'm reading it wrong. The immune system in the body system is for fighting disease, right? So what happens over a period of time? HIV virus weakens your immune system over a period of time, right? And when it's compromised or weakened to a point, right, a person becomes vulnerable to all types of germs and bacteria and viruses and some other agents that might cause disease. When HIV is left untreated, right, when we're not taking our medication, right, or we're not taking it as prescribed, right, it will definitely wreak havoc. The virus will definitely wreak havoc on your system. As this happens, the body is less able to fight off certain infections. You know, the lower your immune system, the less of a chance you have of fighting off that infection or that virus or whatever it is. The human body can't get rid of HIV, right? There is no effective cure for HIV. Let me say that again. So basically what I am saying is once you acquire HIV, you will have it for the rest of your life because there is no cure at this time. Are they working on a cure? Yes, they are. But at this stage in time, have not reached one. So, but here's the good news, right? This is the good news, right? If you have HIV, you just found out that you have HIV. The good news is that you can live. You can live with this disease because when I first got it, the first thing I thought that I was going to die. I just knew that I was going to die. So the first thing when they said you're HIV positive, the first question that came to my mind is how long I got. You know, so I wanted to share that with y'all. I wanted to let you know that you can live. And you can live through HIV medications, which is called ART or antiretroviral therapy. Okay, so that's the good news. So HIV cells infect cells, right? The CD4s help protect the body from other illnesses. So let's talk a little bit about this. Okay, so when we talk about, matter of fact, we're gonna back it up because before we get to this part about HIV infects your CD4 cells, something must have happened before that. So we know that in order for this stage to take place, transmission had to happen. And that transmission happens only through one of the modes, right? We got blood, semen, pre-cum, vaginal fluids, breast milk, and anal fluids. So there has to be through one of those modes of transmission even for you to get to this part. But once you get to this part, when we talk about HIV cells infect your your CD4 cells, right? This here is I don't know if y'all can see this, but this here is a cell. This is your this is a CD4 cell, and it's been infected with HIV. So what HIV does, you have your two receptors here. You have your what is it, the CCR5 and your CXCR5 receptacles. So what HIV does, it comes down and it attaches itself to these receptors. So once it attaches itself to these receptors, it fuses with it and begins to enter its contents directly into your cell. Okay, so what HIV is made of RNA. Okay, and RNA stands for ribonucleic acid. Okay, and what it does, it drops the RNA into your CD4 cells for one purpose and one purpose only, to change the codes or change the programming in that cell from stop making CD4 cells to protect yourself, rather make more of me so I can destroy your CD4 cells and kill you, basically. Okay. And what it does, and also you can look at this and you can see that this is what's happening. Once it infects this cell, once it's dropped the RNA and it changes the code and say you're not going to make no more CD4 cells, you're going to start making more viruses. And you see here, all these are the notches of the viruses that's popping out all over this CD4 cell, making, by what, it can make up to, I think, 100 copies a day of itself. So this is what's going on without no medication. So HIV and AIDS are not the same. So let's define what is AIDS first. So AIDS is acquired immunodeficiency syndrome, right? So the difference between HIV and AIDS is that HIV is a virus that weakens your immune system over time. AIDS is a condition that happens as a result of HIV and infection when your immune system is severely weakened. Keeping HIV infections in check requires like early diagnosis, right? And taking daily HIV medications for the rest of our lives. Now let's talk about, can a person have HIV and not AIDS? Yeah. Some people might say, oh, no. When I got diagnosed with AIDS. That's because it took that period that the virus HIV then progressed to AIDS, right? Because you didn't have no symptoms or you didn't recognize the symptoms, and it just progressed to that stage. Now, what happens when you get when you get AIDS, can you transverse and go back to having HIV? Yes, you can. Okay, but what that means, you get an AIDS diagnosis, and we'll talk more about that later on. So a person cannot have AIDS without first having HIV. You cannot have the end result without having the virus itself. And that virus is HIV. And again, AIDS is a condition of the virus. Even if it's undetectable in the blood, right? Once a person's been affected with HIV, it remains forever hidden in the body. Right, it goes to certain places in the body that your bloodstream cannot reach, cannot get to. Okay, and because the HIV medication runs through your circulatory system, and that's your blood system. But the virus is in your blood system, but it's also in the lymphatic fluids. Okay, this is why they're finding it in your brain cells, in your brain, on your spinal column, and all these various other places in your body. HIV has the ability to integrate itself into your cells and hide in an inactive form. And that form that I described to you is called your reservoir sites. You know, although the medicines can keep the virus levels low, they don't clear out the viral load, right? They don't clear out the viral reservoir. So if treatment lapses, what happens is if the medication stops working for you by chance, okay, you're not taking it as prescribed, or you're not taking it at all. So what happens when there's no medication present in the body? HIV comes back out and start doing these things again, start attacking your CD4 cells again, and start doing this thing. Without medicine, this is very important, right? Because, you know, I've been talking about people that don't take their medication. This is what happens without medication. People with AIDS typically survive about 3 years, right? Without medication. We're talking about AIDS and without medication. Okay. So once someone has a serious opportunistic infection attached with that, the life expectancy without the treatment falls to about a year. HIV medicine can still help at this stage of infection, right? It can even be life-saving for some. You know, I have talked to people and been around people, you know, that their viral load, their CD4 count was totally depleted or won, you know, but look at them today. You know, they didn't give up. They done what their doctor told them to do, took their medicine as prescribed, and they made a turnaround. It can happen. If you get a diagnosis of HIV infection and you begin the antiviral therapy in a timely fashion, you know, and we're going to talk about that a little bit later on when I go on and talk about the stages of HIV, okay, in that acute stage, and I'll talk a little bit more about that later on. So what happens is that the earlier you get diagnosed, the earlier you catch this, and the earlier, just from the diagnosis, not the early diagnosis part, but the sooner you get on medication. So that's the important piece here. The sooner you get on medication, right, your diagnosis turns out to be a little bit excellent. I'll be a little bit better, yeah. Okay, to receive an AIDS diagnosis, a person with AIDS with certain signs and symptoms defined by the U.S. Center for Disease Control and Prevention, right, or the CDC. To be diagnosed with AIDS, a person with HIV must have an AIDS-defining condition, have a CD4 count less than 200, right, regardless of that, whether or not a person has the AIDS-defining condition, right? So a certain kind of infection called an opportunistic infection, we know what an opportunistic infection is, right? An opportunistic infection is simply what it says. When your immune system have weakened to a point, okay, that infection, that virus or whatever it is, takes that opportunity to jump on you because they say now is the time. So it takes that opportunity to get you. So let's talk about some of the opportunistic infections, right? You know, for an example, when you get your AIDS diagnosis, or you have your 200 and you have an opportunistic infection attached to that. Some of those opportunistic infection, I'll give you a couple of them for an example. Let's say Kaposi sarcoma, right? Remember that back in the 80s, I believe, when we first came to know what that was, when we first saw it, it was the blue patches and blue spots all over people's bodies and faces and things like that. That's what Kaposi sarcoma is, or PCP, and that's pneumocystis pneumonia, right? And what happens is that, like I said, is they take this opportunity to attack your immune system at this time. All right, your CD4 cells are basically your T cells or your white blood cells, right? And they play an important role in our body's immune system, right? It's our body's defense. We need it, right? We need our soldiers, right? So these cells are destroyed by the HIV. Even when HIV positive person, right, can be feeling just feels well, is not experiencing no symptoms at all. Guess what, y'all? HIV is still doing this thing. You know, and we talking about if you don't have no medication in your system, HIV is always going to be busy about itself if your immune system is not strong enough to rumble it. Because let's admit that there's some people that rumbles this that have a pretty strong enough. It suppresses the virus on its own. God bless them. So when we get here and we talk about AIDS diagnosis, we know HIV attacks our T cells, your white blood cells, right? And uses them to start making copies of itself. When HIV destroys so many of your cells, right, it leads to AIDS, right? Will you die from AIDS? Can you die from AIDS? Let's start with that. The answer is yes. Will you die from AIDS? No. The chances are very slim. As long as you get through it depends on what else is going on with you, because I can't speak to that. But I know this: if you get an AIDS diagnosis, you start taking your medications as prescribed by the doctor, it can have a reversal. It can change. Your CD4 can start going back up, bringing down the viral load. So let's get here and talk about the 3 stages of HIV. Okay, so we're talking about the acute or primary infection, right? So what's going on here? So acute HIV infection is the earliest stage of the HIV infection. It generally develops within 2 to 4 weeks after the infection with HIV. During this time, some people have, excuse me, y'all, somebody knocked on my door. I apologize for the interruption. I do have a note on my door, so I apologize for that. During this time, some people have like flu-like symptoms, such as fever, headache, or some develop a rash. In the acute stage of the infection, HIV multiplies rapidly and spreads throughout the body in this stage. When I found out that I had, when I got my diagnosis, I had hundreds and hundreds of thousands of copies of virus in my body when I found out that I had it. The virus attacks and destroys the infection, fighting CD4 cells, right? During the acute HIV infection stage, the level of HIV in the blood is very high, which greatly increases the risk of HIV transmission. See, if you have you acquired HIV, but you're not experiencing none of these symptoms, then you don't know you have it, but yet you go out and you're having unprotected sex. And this is what happened. This is what has been happening. This is why we have a very high levels of people being having HIV. So let's talk about a symptomatic or chronic infection. And this is the second stage of the HIV infection. And it's also called asymptomatic HIV infection or clinical latency. During this stage, HIV continues to multiply in the body, but at very low levels. You know, at stage 1, it's gone. It's soldiers are in. Let's get as much in and do as much damage as we possibly can. Okay. But at this stage, it's happening. It still can happen, but it's at lower levels. People with chronic HIV may not have HIV-related symptoms. We talked about that, right? You know, what that means is that some people write them off like I did, or some people don't know what the symptoms are to realize that they're having these symptoms, lack of education and knowledge. Without ART, chronic HIV infection usually advances to AIDS in about 10 years, what we talked about. And a lot of things you're going to hear, I've been repeating myself because repetition, you know, works. Repetition. The more you hear it, you will get it. People who are taking ART may be at this stage for several decades, while it is still possible to transmit HIV. Because like if you're not on the medications, the viral load is not suppressed, then you can transmit HIV. Right, to others during the stage. People who take ART exactly as prescribed and maintain an undetectable viral load, right, have effectively no risk of transmitting, right? Remember, read that, let me try to say it again. People who take ART exactly as prescribed and maintain an undetectable viral load have effectively no risk of transmitting HIV to an HIV negative partner through sex. Right? And we know what that is because it's been proven scientifically, and we identify it as U equals U. Undetectable equals untransmittable. So we talk about this final stage. We talk about stage 3, and AIDS is the final, most severe stage of the HIV infection. Because HIV has severely damaged the immune system, the body cannot fight off opportunistic infections, right? And some of these opportunistic infections are infections related, some of them are cancer. So we got to talk about that too. And I've been noticing that a lot of people today living with HIV, it's a lot of cancer or cancerous things that people are experiencing more this day than yesterday, that I believe. So please take care of yourselves and get yourselves checked. So people with HIV are diagnosed with HIV if they have a CD4 count less than 200 milliliters, or if they have certain opportunistic infections, right? Once a person is diagnosed with AIDS, they can have a high viral load and are able to transmit HIV to others very easily. Then, you know, you can transmit very easily. So let's be mindful. Let's always be mindful. If you're HIV positive, protect yourself. If you have an HIV negative partner, protect them with PrEP. And I'm not going to speak on PrEP because I know that's a part of this presentation. We'll cover that a little bit later on. So without treatment, guess what's going to happen, right? People with AIDS, like I said again, typically survive about 3 years. So HIV can only be transmitted through, I already list them, but I'm gonna do it again. It only can be transmitted through the blood, the semen, pre-cum, vaginal fluids, breast milk, or rectal fluid. There's no other means of transmission. You get some crazy ones. Oh, you're in the swimming pool with me. Get out. I can get HIV. Or you smoke behind somebody, or share a utensil in somebody's houses. Oh, you can get HIV. Those are all myths. Those are inaccurate. You can't get HIV from saliva. You're gonna need truckloads of spit to even acquire it like that. So that's not going to happen because some people are afraid to kiss people with HIV because of that fear. But there's no other means of transmission except these. No other. So the transmission equation. So we talk about the fluids, right? We already listed the fluids, the blood, the semen, the vaginal fluid, the breast milk, and the rectal fluids, right? But when you got those fluids and then you mix it in with common ways HIV is transmitted, right? Barrierless sex, right? You know, unprotected sex, not putting no condoms on, the female condoms, not using no dental dams or no form of protection. Side note, y'all, if you need some type of protection or some type of covering and you don't have a condom or a dental dam, you know, you can use saran wrap. You can use saran wrap if you don't have nothing else, but not the saran wrap that goes in the microwave because that has pores in it, so the virus can slip through that. Okay, so you want to use the saran wrap, not microwavable. And the most ways of transmission would be anal, vaginal, or oral, you know, but somebody first have to have the virus. Sharing needles or injection equipment with someone who is HIV positive, right? And I have to tap on this a little bit because it covers more than just sharing like syringes, because we think of when we say drugs, we think of all negative, but what about hormones, right? What about insulin? You know, because people take them too, you know, but and if you have to, you know, share a needle for whatever reason, please bleach that needle to kill that virus or to kill anything that might be in there. Clean it with bleach, the whole, everything that you're going to be using, clean it with bleach and rinse it very well afterwards before you use it to help take that risk down from you getting HIV or something else. Mother to child during pregnancy, birth, or best breastfeeding on this stage, this really, I think it's a very low number percentage rate to whereas when I first 20 plus years ago, it has dropped that people who are HIV positive, they taking their medication, they have HIV negative children. You know, so thank you, Jesus. That's just me because I've listened to people who were born who didn't have a choice in it at all. And it hits them a little bit different than it hit me. That's all I'm going to say about that. Or you can have occupational exposure. In that occupation, you could be a police officer, nurse, you know, some working in that field, right? You get a needle prick, police officer, you know, they might be going through somebody's pockets or something like that there and get stuck by a needle. You know, it happens. But in that case, if you get stuck by a needle or there's PEP for that. I'm not going to speak on that because that's also a part of this presentation. But there's things or steps that you can take in order to protect yourself if you get accidentally stuck by a needle or bit or whatever the case might be. I'll let Grace is going to speak to that. So let's talk about the entry point into the bloodstream, the lining of the anus or rectum, or the lightness of the vagina or the cervix. And that is because of friction, because of tearing, okay, because of the tearing, okay, which blood is present, okay, and now you have an opening for the virus to get in. The read-through, opening up the penis, right? Excuse me, y'all. A mouth that has sores or bleeding gums, you know, cuts or sores, needle stick, and that all equals HIV. If you have somebody that got HIV in their blood and they pass it through unprotected sex or sharing needles, and then it gets into the bloodstream, it's in your bloodstream, then you got it. So, HIV, what is it? HIV prevention. I'm sorry, I can't see it through my screen, plus my glasses. My apologies, y'all. So, HIV prevention. Use protective barriers such as condoms during sex. And I already told y'all about, you know, a plastic wrap. You want to feed infant formula if you have HIV rather than breastfeed. You know, you want to avoid sharing syringes or needles when injecting anything, drugs, hormones, insulin into your body, right? Today, the more tools than ever are available to prevent HIV. You know, we're out here educating people. We're out here talking about it. We have various different medications. Now we have different modes of getting the medication in you. So we have a lot of things today, you know, and that comes from, let's lift up and say thank you to all them people that was before me that went through all these trials, okay, to come up with these pills and stuff so that I can take it and live long. So I want to lift them up during this process also, because if it wasn't for them, we wouldn't have these things if these people didn't take part in these research trials. You know, you can use strategies such as abstinence, right? We could talk about abstinence is the purest way. No sex, can't get it that way, right? Never sharing needles, using condoms the right way every time you have. When we talk about using a condom the right way, we want to check on first, before you put the condom on, you take it out, you want to check the date. You want to make sure that the date on the condom is right, it's not expired. Okay, but you also want to tap on that condom to make sure it has no holes in it. Okay, so once you do those things, and then once you put the condom on, you want to put the condom on correctly. You know, you want to put it on the Jimmy Don and leave a little room up top, but you want to put the condom all the way down to the base. That's wearing a condom properly. You may also be able to take advantage of HIV preventive medicine, such as, so we talked about PrEP, and, you know, PrEP being the before pill and PEP being the after pill. And I'm not going to speak no more about them. If you have HIV, there are many actions you can take to prevent transmitting HIV to others. So that's my part of it. I'll come back in later on, and I'm going to hand the mic and the phone over to Grace.
Thank you, Steve. That was great. And welcome to PEP and PrEP, the wonder medication that will save you from an HIV diagnosis. And as you know, prevention is better than cure. I will shock you in a second and read out to you some lyrics, because when we are talking about PrEP and PEP, we are talking about sex. And sex is a topic that a lot of people avoid. We don't say it all the time. We say, hi, goodbye, how are you doing? But we don't say, how was sex last night? So I'm just taking a line. I'm gonna let's take a moment and listen to the lyrics of one song artist, Habi Azar, who sang the song, Let's Talk About Sex, Baby. Let's talk about you and me. Let's talk about all the good things and the bad things that may be. No disclaimer, no offense meant. Let's talk about sex. Let's talk about sex. Let's talk about sex. Even as we are doing this presentation, sex is happening somewhere. It's the reality. Let's talk about sex for now to the people at home or in the crowd. It keeps up coming anyhow, even if you don't talk about it. So don't be coy, avoid, or make the topic void, because that ain't gonna stop it. Now, we talk about sex on the radio and the video shows. Many will know anything goes. Let's tell it how it is and how it could be. That's what PrEP and PEP is all about. How it was, and of course, how it should be. How you should take your medications, how you should have sex with condoms and have condoms in the right way, as Steve has said. What about those of us who think that sex is dirty? Well, they still have a choice. Pick up the needle, press, pause, or turn the radio off. But will that stop us? PEP? I doubt it. All right, then come on, Spain. Let's talk about sex, baby. It says, let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things and all the bad things. I could sing this song all day, but some of us only sing it in karaoke, while some listen to it under the bed. What is pre-exposure prophylaxis? PrEP. PrEP is one pill swallowed once a day, Truvada mostly, although we do have Descovy and Apretude. And it is more than 95% effective at preventing HIV infection. When you're talking of prophylaxis, prophylaxis is an action taken to prevent disease, especially by specified means or against a specific infection. Prophylaxis, prevention. PrEP is not 100% and doesn't protect against other STIs. So condoms are still recommended. Steve already talked about condoms, so I'll run over that. And the good news is that most insurance plans cover PrEP. But even if the insurance plan does not cover it, you may still get help at the clinic, through the social worker or through the case manager or through your doctor. PrEP is approved for all people, regardless of sex or gender, who are HIV negative. And when I talk about all people, remember that research tells us that over 51% of 50+ people, or people who are elderly, are living with HIV. Just remember that imagine that worldwide, out of the 4.2 million people in the world, 13% are living with HIV. And in the US, more than 50% of the population in the US are elderly. So if 51% of this population is living with HIV, what is going on? It means that those of us who are even 85 years old, even 100 years old are having sex. I just read on Facebook of a 101-year-old man who just had a baby. So sex is going on. Steve, let's go to the next slide. So how does PrEP work? We talk about the HIV life cycle. HIV has 10 stages of the life cycle. And the first stage is the binding, where the HIV virus attaches itself to the cell and tries to intrude into the T cell. Well, you know that the T cell is the white blood cells that fight invaders and infections in the body. The T cells are really, really important. They fight off infections. When a virus affects your cell, the T cell has different functions. Sometimes when an HIV virus affects the cell and it realizes that it is infected, it might commit suicide. That process is called autopsy. See, what's that process called? Autopsy. Sometimes when the virus infects the cell, the T cell realizes that it's infected, so it kills it. Yeah, so the virus can either commit suicide, or the T cell, realizing that the virus is infected and does not want the virus to infect the whole body, will kill it. Okay, so the T cell is so important. And what PrEP does, it blocks the virus from entering the T cell. Yeah. It blocks it, it goes around it and just completely blocks it. So it stops the virus at the first stage of HIV cycle. Next slide, please. And remember that the T cell is made in the bone marrow. You can see where the T cell is, right in the center. And as you can see the blue area, that is the PrEP. That is the Truvada, your medication working and ensuring that the HIV virus does not get into the T cell. You know that the T cell is also made in the bone marrow and it matures in the thymus, a gland here in the heart. Yeah. So the T cell has receptors that recognizes specific antigens or foreign substances on the surfaces of the cells and block them. So this is why PrEP is so important, because it blocks the virus from entering the body. Next slide, please. So we have a lot of common myths about PrEP. One of the myths is that PrEP isn't a drug for someone like me. And someone like me, it might be like, maybe you have a high-paying job, maybe you're a CEO of an organization, maybe you're the president of a country, maybe you're a medical doctor, or maybe you're just too beautiful to get infected by the virus, or maybe you're good on, maybe you are world-wise, like you know what to do, you don't fit into that category, like you know, all that kind of stuff. But PrEP can help protect anyone. Anybody can get HIV. HIV knows no status. It does not know whether you have a 6-figure salary. It does not know whether you have a condo. HIV will infect you when it's ready, okay? So PrEP can help protect anyone from acquiring a new HIV diagnosis, and anyone, remember anyone, including your father, your mother, your sister, your brother, your boss, can acquire HIV virus, including you and me. Another myth is that PrEP encourages unsafe sexual behavior. No, it doesn't. Old habits die hard. If you are doing something before, you'll continue doing it. As Wahida normally says, our fight ambassador, if you are a thief before you got HIV, you will remain a thief after you got HIV. If you are a liar before you got HIV, you will continue being a liar before HIV. So PrEP encourages, and PrEP does not encourage unsafe sexual behavior. In studies of participants taking PrEP, it was not shown that PrEP increases risky behavior. Yeah. So there was a group of anti-activists who decided who are fighting against people getting PrEP. They were like, oh, you're spoiling our young people. We do not want you to give our young people PrEP because you'll make them go out and involve in orgies. No, that was not the case. Our research studies show that nothing like that happens. Next slide, please. So we continue with some of the common myths about PrEP. I do not know if you have any myths about PrEP, but you can put them in the chat if you have any myths that you've heard about PrEP. But again, one of the myths is that if you are on PrEP, there's no need to use condoms. No, you do need to use condoms. As we talked as you heard in the early session of the presentation, PrEP is important. You need to continue practicing safer sex for prevention of STIs and pregnancy. You know that condoms burst. You know that a condom may slide out when the ride is too rough. You know that some people may forget to use condoms, especially maybe when you have taken a little bit too much, or sometimes the emotions may overwhelm you and you might just decide like, no, I just don't want to use condoms. So while taking PrEP, it is important to continue practicing safer sex, especially for prevention of other STIs and pregnancy. So PrEP will not protect you from pregnancy. PrEP will not protect you from syphilis, gonorrhea, chlamydia, and all the other infections, all the other STIs. The other myth or false belief is that PrEP leads to HIV medication resistance. No, resistance can only occur in the presence of a virus. PrEP is for those who do not have the virus. So what will you resisting if you do not have the virus? So that's another misinformation. Next slide, please. So what is so we have PrEP and we have PEP. We are talking about PEP, and as I said at the beginning, welcome to PEP, the Wonder Med that will save you from an HIV diagnosis. PEP is post-exposure prophylaxis. It means taking antiviral medicines after being potentially exposed to HIV to prevent becoming infected. You may be exposed to HIV through in various ways. You can be exposed through rape. You can be exposed through regular sex. You might be exposed in different ways. You might be exposed through those of us who work in the medical setup, you might be exposed when you have an injection. A lot of phlebotomists, those who do our blood work, do get exposed sometimes. So PEP must be taken within 72 hours after an exposure in order to be most effective, but the sooner the better. Again, PEP is taken once or twice a day for a month. PEP helps prevent the virus from entering the CD4 cell and replicating, but it is not 100% effective. So the difference between PrEP and PEP is that PrEP is before having an HIV infection. PEP is being exposed within, PEP is being exposed, potentially exposed. Okay, with PrEP, it is you having sex with a partner, or making a decision to have a sex or having sex regularly, and then you need to protect yourself from getting an HIV infection. With PEP, it is an exposure. You have not got the infection, but there's a potential or there's a probability that you may get an infection. So within 72 hours, you need to rush to the clinic to get that medication. Next slide, please. So is PEP right for you? If you are HIV negative or do not know your HIV status, and in the last 72 hours, you have had an exposure, you think you may have been exposed to HIV during sex, for example, if the condom broke, or you share needles. We talked about needle sharing in the first session, and works to prepare drugs, or you are sexually assaulted. These are the situations where you need to go for a PEP. Exposure during sex, sharing needles, or you are sexually assaulted. If you can answer yes to any of the three situations above, talk to your healthcare provider or rush to an emergency room, doctor, and every hour counts. Remember, every hour counts. Yeah. So do not feel ashamed if you have had an exposure, a sexual exposure. Get help so that you protect yourself against getting an HIV infection. As we said, prevention is always better than cure. Next slide, please. So if you're a healthcare worker and think you've been exposed to HIV at work, please do not wait and finish your shift. The money might be important, but your health comes first, okay? Do not wait for several days and say, I have to finish my work. PEP should be considered if you've had a recent possible exposure to HIV at work. Also, occupational transmission of HIV to healthcare workers is extremely rare. We do appreciate our phlebotomists, our doctors, and those who work with occupational hazards at this time, because we know that once in a while you do get that exposure, handling needles and handling everything else that is an occupational hazard. So the sooner the better, every hour counts, and we appeal to supervisors, bosses. If your person gets exposed at work, please allow them to go get the care that they need. Next slide, please. So let's look at some of the common questions around PEP that we keep asking. Can I take a round of PEP every time I have unprotected sex? You might have had these questions in mind, but they're here. Before you put them in the Q&A, we could have a look at this page. Can I take a round of PEP every time I have unprotected sex? So PEP should be used only in emergency situations. PEP is not the right choice for people who may be exposed to HIV frequently. If you're having regular sex. If you often have sex without a condom with a partner who is HIV positive, if you are at ongoing risk for HIV, speak to your doctor about PrEP. I'll go through that again. PEP is not the right choice for people who may be exposed to HIV frequently. For example, if you often have sex without a condom with a partner who is HIV positive, if you are at ongoing risk for HIV, speak to your doctor about PrEP. Okay. If you're having regular sex with your partner, speak to your doctor about PrEP. Where can I get PEP? Your healthcare provider or an emergency room doctor can prescribe PEP. Talk to them right away. if you think you've recently been exposed to HIV. If you're afraid to go to the clinic or the emergency, you can call your doctor and they can actually mail you an overnight test kit, okay? Or they can schedule for you how to reach to get help as soon as you can at a nearby clinic, like at FIGHT. How can I pay for PEP? If you are prescribed PEP after a sexual assault, you may qualify for partial or total reimbursement for medicines and clinical care costs through the office for victims of crime funded by US Department of Justice. And if you're prescribed PEP for another reason, and you cannot get insurance coverage, like Medicaid, Medicare, private or employee-based care, your healthcare provider can apply for free PEP medicines. Remember that. If you do not have prescribed PEP, your healthcare provider can apply for free PEP medicines through the Medication Assistance Program. And if you're a healthcare worker who was exposed to HIV on the job, your workplace health insurance or workers' compensation will usually pay for PEP. That's why it's important as an employee to be in touch, to continue checking on your employee guidebook, because this information is there. Go on that page of benefits and claims, and you will find that your healthcare, if you're a healthcare worker who was exposed to HIV on the job, your workplace health insurance or workers' compensation will usually pay for your PEP within 72 hours. Remember that. Next slide, please. So CDC recommends getting tested at least once a year. And then people with multiple sex partners, inconsistent condom use, or if you share needles, you should get tested every 6 months. We have OraQuick rapid HIV tests that are sold over the counter to the public. I think at Walgreens, Rite Aid, CVS, they go for about $19, but in the other clinics and pharmacies, it could be $280, but check with your pharmacy. So and some are free. Many organizations provide 1-minute rapid testing. And if you come to Philadelphia FIGHT, we have free rapid testing boxes. Just come to the 3rd floor, 1233 Locust. Next slide, please. So we know that HIV treatment, we know that treatment is prevention, and HIV treatment has come a long way over the years from the 80s, when people were dying from AIDS, when people were discriminated against. The stigma still continues, but we've come a long way through research. So today, HIV medication is much more effective and people are less likely to experience side effects. So for some of us who are taking medications like AZT, where you took 36 medications, we've gradually gone down to 2 medications. And some people have gone down to 1 medication, which is Biktarvy, due to research. And others have gone down to Cabenuva, which is like once every 2-month injection. Yeah. So today, HIV medication is much more effective. You can come to work with an HIV diagnosis, take your medication as normal. You can go out to a dance, you can get married, you can go back to school. You can do so much today because of HIV medications. It's not like those years when you spent all the day in the bathroom, you know. You could not even go when you're invited to a party, to Thanksgiving or by your family, you said no, you could not go because you'd be embarrassed. And a lot of times your family did not even invite you for Christmas, for New Year's, for birthdays. You are lonely, you are all alone, but this has changed. So, but there can still be numerous barriers and side effects preventing or hindering a person from taking or adhering to your medication. And you look at stigma as one of the causes that may make someone not adhere to their medication. There are also reluctance to take medication because of side effects. You know, you don't want to feel sick all the time. So some people abandon their medication, but you can reach out to your doctors. A lot of these side effects can be managed. And especially those who fear taking a PrEP because of side effects. The side effects for PrEP will be there for a little while, but they will go away after about 2 to 3 weeks. And then don't confuse the side effects for PrEP with those of HIV. some of the people on PrEP might have side effects such as nausea, stomach pains. You might have diarrhea. But if you have side effects for HIV, it might be something like a rash, a flu, what some of the symptoms that you get in the chronic infection stage, which is the first 2 weeks of getting infected. So the care team and support network can be very influential in supporting your efforts in prevention. So when you're working to prevent HIV, whether it's PEP, whether it's PrEP, whether it's you're already infected, you already are taking HIV medications, make sure you work with your team so that you minimize the side effects, you minimize your fear, and you're able to lead a nearly normal life. We have other factors that may prevent someone from taking the medications, housing issues. A lot of us are homeless out there. You know that some people have their medications out there stolen. You know that housing is prevention, because some medications need you to be consistent. You need to be home. You need to be in a safe environment. Another reason you may not adhere to your medication could be addiction, or you might be out there on the streets. But there is harm reduction. We have places that offer harm reduction that can help. Again, at FIGHT, we have an adherence program with the pharmacy and the LAC Center on 4th floor, where you can keep your medications there and go and take them at any time of the day with a good meal, and then just leave your medications there. If you are in an abusive relationship and the partner does not know your status, you can also bring your medications or work with your pharmacist in whatever clinic you go to, and go take your medication there every day and just go back home so that your life is not endangered. Next slide, please. The question, I don't know if we'll do the question and answer session later, but there's a statement from Madeline Piper that says if someone was potentially exposed to HIV in Philadelphia, or there are residents of PA, they can call the 24/7 PEP hotline. That's great information to be connected to PEP and a doctor. And the hotline number is in the Q&A page, 833-933-2815. It's great to know that you have a PEP hotline for PA. So let's go to U equals to U. And if you have any questions, please keep them coming in the Q&A session. U equals to U is undetectable is equals to untransmittable. What does undetectable mean? It means that people living with HIV who adhere to their medication could get to a point in time when their HIV viral load is at or below 20 copies per milliliter. Viral load is the amount of virus a person has in their body. And sometimes I call the virus germs, the amount of germs of virus you have in your body. So undetectable means you have less than 20 copies of milliliters of the virus in the body. And untransmittable means that if you are undetectable, you will not pass HIV on to your sexual partner. Isn't that amazing? If you are untransmittable, still we are giving ourselves a clap. If you are untransmittable, you will not pass HIV on to sexual partner. If a person has fewer than 20 copies per milliliter of virus in their body, they will not transmit HIV to someone else. But let's continue with that topic. On to the next slide, Steve. So more on U equals to U. So this transmitting the virus to a partner only works when it's a vaginal and oral sex and anal sex. Am I right, Steve? It only happens, are you? Yeah, so the transmission only happens through sex, okay? By sexual means, vaginal and oral sex and anal sex. So let us look at the transmission clip on our page. Vaginal and oral sex. Yes, if you're undetectable, you cannot transmit the virus sexually, but still consider using PrEP and condoms for additional protection. Okay, again, when you're undetectable, you cannot transmit the virus, but still consider using PrEP and condoms for additional protection. Okay. You can still get STIs, you can get pregnancy, you can get mother-to-child breastfeeding, and you can get the virus through sharing of the needles. So remember, barrier methods can reduce your risk for STIs. Barrier methods and birth control can protect against pregnancy. I know there will be questions on the U equals to U. There are documented cases of transmission through breast milk from undetectable mother to her child. And then it is never recommended to share needles or wax. You can do harm reduction through safe exchange of needle programs. Next slide, Steve. So these are HIV services. For HIV case management, if not available through a medical provider's office, HIV case managers are assigned through Philadelphia's Uniform Access Benefits Program. Did you go? Okay. And the reason we are talking about HIV case management, these are some of our services of FIGHT. You can talk to a case manager to help connect you with your doctor, or you can talk to your doctor to help connect you with your case manager. But if you need case management, if you are doing PEP, if you are doing PrEP, if you are doing HIV adherence, if you are on HIV medication and you do not have a case manager, you can get one through the contact that is on the screen. If also you need HIV services, one of them is long-term housing. The other day, the Pennsylvania just opened housing facilities or a housing list. I think the deadline closed, but you can also get in touch with the age-specific housing that is accessed through HIV case management. Your case manager will know somehow. They will know about DIFA, which is the $2,000 given to someone living with HIV who needs new housing or who wants to move. If you are having housing problems whenever you are living, where you are living, and you need to move to a different housing, and you are under HIV services, you are eligible for a $2,000 grant DIFA, which you get in exactly 3 weeks. And you can pay for your 1 month rent and 2 months deposit. So get in touch with your case manager or get a case manager so that you can have access to these benefits. The other place is AIDS Law Project, AIDS-related legal issues or criminal issues. A lot of us who are living with HIV normally tend to try and do our will, and you need to be realistic, have your power of attorney, have your will done ready, make certain decisions in case you end up in hospital and certain decisions have to be made, then there will not be chaos. Everything will be in order. And the screen also has that information. Next slide, Steve. So when you have questions, these are the services we offer at Philadelphia FIGHT. Yeah, these are services that we offer. When you have questions, these are the good places to go to for more information. We have the Critical Path Learning Center of Philadelphia. As you can see, it's a beautiful place. You can see my background. This is where you have our reference librarian. The information is there. We have books here to read. We have a drop-in center where you can bring in your clothes to be washed once a week. We call it the hospitality department. And then you can also go to the internet for more information on HIV. Use the US Department of Health and Human Services information sheets, and then go for the credible and reputable websites that have been tested and tried, like the AIDS Info, NIH.gov, the CDC website as well. Next slide. So before Steve goes to the bottom line, 1 second, Steve, I just want to say that Truvada is mostly for people at risk through sex or injection use. But another PrEP medication that is in use is Descovy. Descovy was approved through the clinical trials about 3 years ago. And Descovy is mostly for people at risk through sex, not for people assigned female at birth who are at risk of HIV through receptive vaginal sex. And then we have Apretude, which is only a shot approved for PrEP, an injection shot approved for PrEP for people at risk through sex. And if you are taking Apretude, you have to be at least 77 pounds. So of course, when we teach about HIV in our classes, we remind our participants that it is important to see your nutritionist and know what kind of food you are eating, because your weight actually affects what medication or prescriptions that you are given. So thank you, and I'm going to go back to Steve to round it up so we have enough time for the questions.
Thank you, Grace. All right, here's the bottom line, y'all. There are only 5 fluids that transmit HIV: blood, semen, vaginal fluid, breast milk, and anal fluids. HIV and AIDS are not the same things. One is the virus and one is the end result. There are many different prevention techniques, including treatment as prevention. If you are in need of support, check out the resources available to people living with HIV in Philadelphia. Thank y'all for allowing us to do this presentation for y'all. We appreciate it and we are grateful.